Hello, my name is Candice McNaughton, and it is such a pleasure and an honor to have the opportunity to speak with you all. I am recording this in Toronto, where I work as an emergency medicine physician. I work at Sunnybrook Health Sciences Center, and I'm also an associate professor at University of Toronto, where I work as a researcher. In the interest of transparency, I'm reporting my disclosures and disclaimers. For the next 45 minutes, everything that you hear me say reflects only my own opinions and experiences and does not reflect any official positions on the part of my funding sources, or for that matter, on the part of the church or anything else other than myself. Also, in the interest of transparency, I want to give you a little bit of my background just to sort of set the stage a little bit. So graduated from BYU in 2001. I then went on to attend medical school at Washington University in St. Louis, followed by residency in emergency medicine at Vanderbilt University. Following residency training, I did a 2-year fellowship in patient safety and quality improvement at the VA with a concurrent Master's of Public Health. And then because I realized I did need additional training at that point to do the research that I was interested in and continue to do, I went on to do a PhD in epidemiology. In addition to my secular training, I was fortunate to serve as a temple worker in the Boston Temple and in the St. Louis temples until we had our first child. And then, from a church standpoint, since then, I've mainly served in the positions of ward organist or pianist. So that's a little bit about me and just to set the stage in terms of where I'm coming from. In terms of what I hope you all get out of the next little bit from this discussion or talk is 2 things. The first is that being right or having information or science alone is just not enough. We have to be able to act on and share our knowledge. So sort of in the way that faith that works is dead. Science without application and use to help other people is just not useful. And actually, I sort of feel like there should be almost an imperative that if we have knowledge and the ability to improve life for those in our church community, as well as those outside our church community, we really should do that. And that is the second point that I'm hoping that you'll take away from my talk today. As a good friend pointed out, science and revelation can be thought of as 2 wheels that can be part of the guidance in our spiritual lives. Science is an approach to obtaining knowledge through logic and empiricism, and science is complementary to revelation. So you need both science and revelation if you're going to be able to get anywhere, and you have to actively use both science and revelation if you're going to push that wheel and get anywhere. So that's, starting again with the end in mind so that hopefully you'll be able to use this time for benefit. I'm going to take a few minutes to sort of indulge and say thank yous to some of the people who were instrumental in my education and career path. These 2 gentlemen, I really have to thank personally. So Dr. McCleary, seen here with me and my husband at our graduation. I have to thank him for his teachings. I think about the material that I learned in his courses every time I treat a gram-negative infection, which is pretty frequently actually in the emergency department. That knowledge, it turns out, has ended up being very helpful clinically. And then I want to give a quick shout out to Dr. O'Neill. I attended my very first research conference because of work in his lab. And that's also where I first started getting to know my husband. That's also where I learned that bench work is not something I do well. I am absolutely no good at keeping cell lines alive. So good to know that as an undergrad. And then there are a couple of other folks from a science standpoint that had a pretty important impact in terms of my career development as well. One is Dr. Michael Young, who I shadowed in the emergency department locally. At the time, I didn't even know emergency medicine was his specialty. And there was something about the way that he interacted with patients that really sort of left an indelible mark that it really had an impact on my decision to go into emergency medicine. There was something really just sort of striking about the individual encounters that were so different from one patient to another and not really knowing what was going to come through the door. There's another physician who also had a pretty strong influence on the career trajectory and education that I had over the following 10 to 15 years after BYU. And his impact was a little bit more complicated. This physician who I also shadowed sat me down at one point in the shadowing and told me point blank, almost word for word, that I should not go to medical school because I was going to take a job from a man who would actually work. And for me, it was the first time that I really experienced something like that, so direct. I think up until that point, I thought that maybe discrimination like that was a thing of the past, or that, maybe it was something that, happened under different circumstances, but certainly not something I had experienced up until that point. And it was the first of a couple of experiences sort of like that sort of changed my perspective on the way we interact with the world, and in the way that I interact in terms of working with trainees and learners. And then on a more positive note, I also want to say thank you to Dr. Poli. Paul Poli was my piano teacher while I was here at BYU, and he passed away in 2013, unfortunately, before I could publicly thank him. I was under the delusion that I could somehow manage to be a microbiology major and a piano performance major. And so while I am 100% positive now that he knew that I was never going to be able to manage that, he was kind enough to continue to let me take lessons from him. And that has been a source of joy ever since. And so and honestly, it's probably something I will continue to maintain even after I retire from medicine. So his impact was really important. And then I also want to say a thank you and a shout out to my husband, who has been with me through all of my training. I have to say, like, this poor soul, he's such a patient guy. He's been sort of the foundation and a rock that I have come to rely on. So why he tolerates my quirks, I'm not sure, but I'm really grateful that he does. So I want to address the elephant in the room, which is to say the fact that I am not in the room physically with you all today. Last year, we were not able to meet in person at all because vaccines had not been developed for coronavirus. And this year, I'm not able to travel to present in person for a variety of complicated reasons. But I want to say thank you to the folks who allowed me to record this and share it so that I can be with you there in spirit. And to be totally honest, despite the very unusual circumstances, it is really an honor to speak with you all. And honestly, what a time to speak to folks who are in the College of Life Sciences at BYU. I mean, we're in the middle, hopefully it's not the middle, hopefully we're past the middle of the worst pandemic in 100 years. When we need science and public health more than ever. So hopefully this is something that talk that you come away from and it's been worth your time. So this next picture is an actual photo of me in February 2020. I'm just kidding. Obviously, I'm not a prophet, and I don't claim to have any sort of ability to see the future. But I did sort of feel like in February of 2020, a little bit like a prophet of doom. And I have a very different perspective on poor Noah, having gone through an experience in which I saw something really awful coming and, really sort of felt powerless to change it. And nobody believed me. So speaking of February of 2020, because of the training, the education that I received at BYU in microbiology, and then add on top of that medical school and a master's of public health and PhD in epidemiology, once the data started coming in and enough red flags came up, it sort of became real clear that things were not going to go well. And at that point, I had not until that point really lived through a pandemic like that. So I looked to history to give me some idea as to how things might go and sort of learned from history in terms of what went well and what didn't go well. And I was particularly interested in how things went in Utah because I look to the history of, my family, which has been in Utah since, I guess, the 1850s on one side of the family, because I wanted to learn, what were their experiences. And when I came away from digging through the data, were these questions that I pose to you now, and ask that you consider as I sort of, talk through this material. And they are the questions of what is the role of the church in public health, and what is the role of church leadership in public health when there's a crisis like this? And then finally, and maybe most importantly, what does it really mean to be a good member of the Church of Jesus Christ of Latter-day Saints in times like these? What does it mean to be a true saint? And as I sort of went through the data, the sub-question that came up around that is, how did Utah do so poorly in the 1918 flu? Like, what happened? Because I was very surprised by how poorly things went in Utah during the 1918 flu pandemic. So here's a brief sort of timeline. But the key part here actually sort of starts in the next slide, which is when I started getting into the second wave of the pandemic and how things went in Utah, because Utah was pretty well spared from the first one, in the first wave. The second wave, I think they thought that they were a little bit spared. So on September 25th of 1918, there's a newspaper article or a statement somewhere by a public health official that the flu has missed us in Utah as yet. It's popping up across other parts of the country, but not in Utah yet. And on the 27th, the health commissioner in Salt Lake City, puts out a statement that says, something along the lines of like, it's something we're paying attention to. It's not here, but masks are really helpful in stopping the spread. And then where things really get interesting for me in terms of timeline is October 3rd. And this came to my attention when I was reading D&C 138 about redemption of the dead, and noticed that he notes October 3rd as one of the dates, as the date that he received the largest portion of that revelation. And then on October 4th, although he was in poor health that year and not expected to speak at General Conference, the prophet goes to General Conference and he gives a portion of D&C 138 as a talk in General Conference. So he talks about redemption of the dead in General Conference during October of 1918. And as I was sort of piecing this together, I sort of had a dawning sense of horror, because I don't remember learning as a child that we had a prophet who died of the 1918 flu, but I was starting to suspect that maybe that was actually the case as I was going through the data. So October 4th is kind of a big day in Salt Lake City in 1918. So the prophet gives a General Conference talk that includes much of D&C 138. And that same day, the Salt Lake City Board of Health met to discuss several cases of influenza that were identified in Salt Lake City, even though the week before they were kind of like, oh, maybe this passed us by. And then later in the day, they meet again because they have come to learn that several dozen cases of influenza have been identified in Colville, Utah. And they instruct them on the 4th, the same day that the prophet's talking at General Conference, in this other city, they asked them to stop meeting in large gatherings. By October 9th, Salt Lake has also been asked to stop having large public gatherings, and everything sort of stayed closed through January. By October 18th, Joseph F. Smith has submitted the talk he gave in General Conference to their brethren, and they approve it on October 31st. October 26th, a mask mandate is instituted. On the 30th, they start quarantining people in Salt Lake City. On November 1st, the local officials say that they're not going to enforce the quarantine. And then on November 11th, they decide to celebrate Armistice Day. So World War I had just ended. It was to that date sort of the worst war known to mankind. And so people wanted to celebrate. And we now know this day is Veterans Day, but there was a recognition on the part of public health officials that this could be very bad. And it turns out it was. By November 19th, the prophet Joseph F. Smith died of what was called pleurisy, and he's buried on November 22nd in a private ceremony. It couldn't be attended because they couldn't have large gatherings. And pleurisy is inflammation of the lining of the lungs. In some sources, it's described that he died of pneumonia. Based on the timing, He almost certainly died of the 1918 influenza virus. So just to put this in really stark terms, this is when the prophet Joseph F. Smith receives the last part of the revelation for DNC 138. And this is when he gives that talk. And they identify dozens of cases of influenza. They allow General Conference to continue. So lots and lots of people going to Salt Lake City and then meeting in an enclosed area and then going home and spreading the virus. We've got the mask mandate here. Not going to enforce it here. We have Armistice Day and large parades here on the 11th. And by the 19th, the prophet of our church has died. And it's not till June that they can, June of 1919, that they're able to confirm or that they're able to hold another conference. They postponed it in 1919 because of the flu. And so the timing to me was just sort of really striking. And just to sort of put a really fine point on it, October of 1918 was the deadliest month in American history. 195,000 Americans died in that month alone, which up until the COVID-19 pandemic was the worst thing that honestly had ever happened to our country. The 1918 flu killed more people than all the wars up to that point. Now, COVID has outmatched all of that, unfortunately. And like I said, the thing that was striking to me is that Utah had one of the worst death rates in the country. Second, I think, second worst overall. And I think it's just sort of worth noting that BYU did close in October of 1919. And this is 1919 in January when they restarted classes and everybody was required to wear masks. As you can tell, the quality of the masks, maybe not that optimal, and physical distancing was not a thing. It's just sort of interesting. The other thing that I want to note about this picture is the context. So when I went back and I was looking to see what happened in terms of the 1918 flu, to see how things might go for the COVID-19 pandemic, it's important to note how relatively little was known about viruses and about how to prevent their spread. So, for example, let's see here. So only one virus, vaccinia, had been cultured at the time of the 1918 flu, to my knowledge. And that was cultured in 1913. Bacteriophages had only been identified in 1915. It's not till the 1930s that we finally see viruses for the first time. And a flu test, as far as I can tell in my brief research, a flu test was not even developed until the 1990s. So in 1918, our prophet dies, and honestly, likely thousands of members of our church die of the influenza pandemic. But at the time, there was no way to diagnose it. There was no way to look at a chest x-ray and see if you've got pneumonia. There was no way to see if you had end organ damage. We didn't have effective treatments against it. We didn't have a vaccine against it, and we didn't really understand how it was spread. We knew that masks did something to cut down on the spread, but we didn't understand that it was legitimately airborne. So they were working at a disadvantage. In contrast to that, for the COVID-19 pandemic, the amount of information that we've had from the outset is unbelievable. It's more than we've ever had in the history of humanity. To give you an idea of how much things are changing and improving, even as we go along. So the N95 mask that was, invented, I think in the 70s, I want to say. Dr. Peter Tsai, who actually is at the University of Tennessee, he's one of the inventors of the N95 mask. He came out of retirement and helped develop the protocols for decontaminating N95 masks so that last year we could reuse them when we didn't have enough of them to go around. So things are changing so rapidly that a technology that was invented by one person is being modified for use as things are evolving in a pandemic. That's unbelievable advancement in knowledge and understanding. Which makes me think of DNC 88-118. Seek ye diligently and teach one another words of wisdom. This idea that as part of our religion, a core concept is that we're going to gain as much knowledge as we can, and we're going to share it with others for the betterment of all humanity. And so all of this together, so this context of the 1918 flu, and this impending pandemic in February of 2020, sort of, as I went back and reread DNC 138, it sort of made me look at things in a little bit different light. For one thing, I really appreciated, I think to a greater extent than I had in the past, how much work the prophet had to do in order to be ready to receive the revelation that he received. So he'd gone through terrible experiences, and he had spent probably years. It's not it's not an exaggeration to say he'd spent years trying to understand what happens to people after they die, especially the ones who don't have the opportunity to get knowledge about the gospel. So it's hard to see that it's hard for me to think that it was a coincidence that the prophet who'd been preparing for years would receive this revelation really on the days right as the 1918 flu pandemic invades Salt Lake City and starts spreading amongst the saints. To me, it feels like the Lord is in a situation where it's almost inevitable that this virus is going to spread. The technology is not around. The scientific evidence at the time was not in a place where it was even possible to consider the possibility that the virus could be halted. And so instead of helping them implement use of science in a way that would protect the saints, he instead, I think, gave them some solace and a way to cope with the death that they were going to experience. In addition to that, I also think it's really interesting in this section that there is a description or a pattern, which we see in other places in the scriptures, where there's this idea of the Lord doesn't go directly to the people that he's trying to teach. He sends his servants in many cases, who then go and teach. And as one of the things that I've learned is the best way to learn a material is to teach it, right? So to the benefit of the people who are ostensibly the servants, who are going to teach the gospel in the afterlife or in the spirit prisons or wherever, they're having the benefit of another way of learning the gospel and living it and having an opportunity to experiment on the word, so to speak, as Alma talks about. But I think it's really interesting that D&C 138 in some ways served as I think a balm or a comfort to the saints who were going to go through this terrible experience. And it also highlights the importance of preparation and of use of knowledge, and the importance of it's so important that knowledge be shared, that knowledge is that the teaching goes on after death. And then finally, that the servants who are used to disseminate the knowledge, I think, gain a lot from that process. So, D&C 138 really sort of like I had, my eyes were sort of opened when I read them last February. I want to go back a little bit because the other thing that I took away from 138 is that in verse 26, it talks about, and yet, notwithstanding his mighty works and miracles and proclamation of the truth in great power and authority, there were but few who hearkened to his voice and rejoiced in his presence and received salvation at his hands. So this knowledge is being shared. It's not received very well often. And sometimes that's because we don't have the full picture as things are being implemented. And then sometimes it's that maybe the servants aren't delivering the message in a way that is all that effective. Maybe I just sort of, as I go through life, my perspective on these scriptures sort of changes a little bit, and it raises more questions, like I said, than I have answers for. But sort of speaking of not having a full picture of things, as I mentioned before, I had a couple of experiences in undergrad that sort of were raised some conflict within me. And so by the time I finished medical school, I was really ambivalent. I was kind of sure that I had made a terrible mistake, actually, by going to medical school. I had been raised to believe that the best way that I could be of service to others was just to stay home and raise my children. And I remember, anyway, there's some formative experiences as a kid that, for me to go to medical school and do residency training, there was a lot of guilt, and I was really torn about this. And so, you can see this is me graduating from medical school. And I brought my daughter across the stage. I think there was one other medical student who had a child during medical school amongst us, and she had gone back after being a physical therapist for a while. So I was like definitely like the oddball out, is a member of the church and is someone married and having a kid. And my ambivalence around, what was my role, what does Heavenly Father want me to do with my life, continued through medical training, to the point where, like, for my residency graduation, I actually don't have any pictures of that, nor do I have any pictures of my Master's of Public Health. And the only person who went to my PhD graduation was my husband, and it's he's the only one I told about it. There was a lot of, it's clear there was a lot of guilt, and I had some conflicting emotions about this. And the other component of this is that there were a lot of questions raised in the course of residency training about like what it meant to be a good member of the church, or a true saint in that context. And I watched, many of my good friends who, when we started residency, were active members of the church, and they no longer were by the end of residency. And it was notable even for my young children. I remember my son asking me at one point when I was a resident when I was going to stop going to church, because he had observed some of our good friends, stop going to church as well. So he thought that was just part of training. So lots of conflicting emotions and a lot of confusion for me personally about whether I had made the right decision about going to medical school and doing research. But I'm grateful. I just sort of kept putting one foot in front of the other. And I was really blessed, honestly, to have been able to serve in the Boston Temple before going to medical school, and then in the St. Louis Temple while I was a medical student, because it sort of gave me like a solid foundation that I could really sort of fall back on when I wasn't able to attend church regularly for many years. So, I just sort of pushed through, and over time, through a series of experiences and when having kids, it turns out being an emergency medicine doctor is really useful when you have children. And then it just sort of became useful over the course of a couple of other experiences. It turns out I would have made a terrible pioneer. I sort of blew through 5 of my 9 cat lives, so to speak, and probably the only reason I'm still around is because I'm a physician. So somewhere around 2019, I had sort of come to peace, with the idea that either there's some decisions that Heavenly Father doesn't actually, it sort of doesn't matter that much, and I had at least gotten to the point where my medical training was like of some use, and maybe it was keeping me alive. But I think by 2020, I think I was really sort of, I hope, able to use the sort of rather unusual training and education experiences that I'd had, I hope, for some use for those around me in the church and outside of it. So, going back to 2020, so let's go back. It's February. I have gone through DNC 138 and gone back and gotten a quick history lesson in terms of what happened in Utah and with the church. And Justin is also a microbiology major, and so we looked at that calendar timeline of events and sort of did the math based on sort of the way things were going in the U.S. And we looked at each other and sort of made the decision to sort of fade into the background. We were going to sort of not meet with people in person for a while and sort of do our part to not spread the virus. But it's not like we were in any position to do much else, we thought at the time. And then because, life is funny, and, I guess things don't happen by chance. Sort of around that time, Justin got called to be bishop of our ward, which was for me completely out of the blue. In fact, was sort of like, wait, how did I miss this? He got called to be bishop. And so this is, so the backstory for this picture is that despite all of the sort of like the very strange things going on in the world, and it sort of felt like, looking at the data that like things were going to go, they were going to be pretty rough for a while. the Lord's hand was still in things in whatever capacity we allowed his hand to be in. So I just have to, sort of describe what his bishopric was like, because I think it was really interesting and striking. So one of his counselors is a biostatistician, so perfectly suited to being able to look at data, interpret it, and then sort of assess the probabilities of events happening, with confidence intervals and some margin of error. His other counselor is a special education teacher who is perfectly suited for helping youth make goals and work towards them. And he is married to an infectious disease physician. The Relief Society president is a community organizer, expert at communicating with people and helping them go through change in a way that very few people have the skill set for. And her husband, Shane Adams, has been teaching college courses online for 10 years, and so was perfectly set up to have the skill set and understanding to help our ward move very rapidly online. Honestly, well before sort of local and area leadership were really ready for us to make that move. But, with the two wheels of revelation and faith sort of working together, watching from the sidelines, it seemed pretty clear. It was really fascinating to watch, these very uniquely positioned people use the knowledge and education and training that they had all gained from these disparate fields of study, working together with the common goal of taking care of members of the ward and helping keep people safe and connected. And it's sort of interesting. I actually want to show a little bit of data from this time. So I can't claim this is not data that I put together, but I've got permission to share it. And so, because there was a fair amount of resistance, we had never done church online before. This was not the way that we did things. And also it looked, frankly, to be premature, especially for folks without the training and the background that, that particular group in the bishopric and the ward had. And so later, this graph was sort of interesting to look at. So the red is the time when church was done online. The green is when church was done in person. And for the local area that we were in at the time, because we actually recently moved to Toronto, so we were in a different area at the time. When church was done online, that's when the community spread was the worst. And so it's sort of looking back in retrospect, it seems clear, I think, that the people who were really moving towards online church were inspired, to be frank. And also, to be frank, it took a lot of discussions and communication, and it wasn't easy for everybody else to see that perspective at the time. It was sort of something that I think became more clear in retrospect. I put this picture up because I just want to highlight that the experience that we had as a way that science and technology was leveraged with inspiration on the part of appropriate leadership in the church to really try to find the folks in church who needed to be protected and taken care of. The Heavenly Father cares about each one of us individually, and he wants us to take care of each other. And so I thought it was a really interesting experience, and not one that I ever thought that I would live through, to sort of see sort of the church, local leadership, and different members of different callings sort of pivot very quickly, and how sometimes that worked really well, and how sometimes it was more of a struggle. And then, what does that mean in terms of my faith? It really sort of helped me sort of step back and say, what really is the purpose of our meetings? I mean, I know we all, I think, have said, the sacrament is the purpose. The sacrament is the reason that we meet together on Sundays, but it really is the reason that we meet together on Sundays. What of our meetings is gospel doctrine, and what of it is, tradition? And when tradition changes, how do you keep the faith, and how do you keep things moving? Those are really interesting opportunity to ask questions. And then we adjusted in other ways. This is just sort of a reminder to me to talk about the differences and changes in technology and the way that we've done things in the church over time. Anybody else remember these large satellite dishes? And at the time, for me, General Conference sort of meant meeting only in person. And it wasn't General Conference unless we were at the Stake Center and we had lunch there, And obviously that's changed drastically. And it's changed even more drastically because of the pandemic. This is one of my favorite miracles of technology, the combination of revelation and science working hand in hand for everybody's betterment. So these are the seminary teachers for my daughter, who's now in high school. And a couple of things I'd like to point out. First of all, this is from a couple of months ago. We stayed physically distant and we all have very high quality masks on. But the real miracle is that they were able to teach seminary remotely. And in fact, they taught seminary from Japan. So they were able to, for several months out of the year. So my daughter was able to attend seminary through her entire freshman year of high school safely from some wonderful, amazing teachers, even when they were on the other side of the earth. And so that's a miracle that I hope we're able to continue in the future to take advantage of. Like, how can we use technology in an innovative way to strengthen our faith and our connections to each other? This is just another sort of example of technology that has advanced in the 100 years since the 1918 pandemic. The saints back then didn't have these sorts of protections in place. And in fact, even now, this was more than a lot of people were ready to accept in terms of protection. This was additional PPE that I purchased, separately, but it kept me safe. And I've been able to take care of patients throughout the pandemic and do it safely, which is a miracle. And then, I think probably the biggest miracle of all, probably the safest medication in the history of humanity. We've got several vaccines that are safe and effective. And I remember when I got my vaccination that it brought tears to my eyes because it felt like an event that should have been accompanied by angels singing in, choirs not together, in person. It felt like a really momentous occasion that was easy to not pay attention to. And this, unfortunately, is the point at which I bring this painting back up from the original slide. This is Michelangelo's painting on the Sistine Chapel, I guess it's fresco, of the brazen serpent. So this is a depiction of the Israelites, half of whom are reaching towards, they've got their faces turned towards this symbol of Christ, the brazen serpent that was put up, and all they had to do was look at it in order to be saved and protected from the snake bites. And the other half of the Israelites, members of the gospel, are not only not looking at this representation of Christ to be healed, but they are actively turning away and they are wrestling with each other. They can't get away fast enough, and they're wrestling with this other snake that presumably is a representation of the devil. Members of the church are not the only people who actively turn away from something that could be life-saving. Hand washing is a perennial issue in medicine. This is a coin to commemorate Semmelweis, who is known for showing that if physicians wash their hands, dip them in lye or bleach before they went in to deliver babies after they had just done an autopsy, that the mortality rate for pregnant women went from quite high and quite variable to consistently low, all because of hand washing. What's unfortunate about Semmelweis is that his message was not well received, and he ultimately died in an insane asylum from sepsis, from an infected wound, unfortunately. And his knowledge was not shared and was not implemented. And in fact was lost for a long time and had to be rediscovered. So, decades later, some other physicians in Ireland rediscovered this, so to speak. And then we still have a hard time getting people to wash their hands, in part because the message is not well received. And so speaking of messages that are not well received, because of a combination of, lack of reception and lack of implementation and, combination of a lot of factors. The pandemic that we're going through right now, despite all of the advances in knowledge and advances in technology, and honestly, revelation on the part of people in some positions to have an impact. We in this country are still experiencing what is now the worst pandemic in our country's history. So, as of this past month, COVID-19 has killed more people than the 1918 flu, which frankly, I grew up thinking of as like sort of the public health boogeyman, like it was the stuff of nightmares. And I have had the pleasure, unfortunately, of it's not a pleasure, it's really honestly a nightmare to try to continue to take care of patients through these events. 1 in every 500 Americans has died of COVID-19. More people have died in Alabama than were born, which has never happened. And then long COVID, which is one of the things that I'm working on research-wise now, is just a whole, what we're seeing in terms of deaths is probably the tip of the iceberg in terms of disability and long-term effects of this. And what's really sad is that there is effective treatment in terms of there is some medication to treat it once you've gotten it, but there's so much more that we have available now that can prevent people from getting infected. And in terms of, the way our church has approached this, so I think it's really striking, thinking back now, the timeline in terms of events and in terms of our transition as a church from to a home-centered, church-supported approach to the gospel, which happened in January of 2019, right? Which is, prescient if I've ever seen anything that's prescient. I love the timing of this article, which I highly recommend you read if you get a chance. So Sacramento, the Lord's Supper and the Influenza Epidemic of 1918, written in or published in January of 1919. It pains me to say, but the church, it used to be that you would like pass around a single cup and then everybody would drink out of it. And there were honestly, just like there are now, discussions about like whether, there were some people who felt that you had to have enough faith to be able to drink out of that cup. And share the pathogens that were passed along. And I just honestly don't think that Heavenly Father works that way. And so for those of us whose goal in life is to, reduce the number of times that I serve as a host for pathogens and certainly reduce the number of times that I pass it on, this was an interesting historical tidbit that I did not know about. Our prophet has been very clear when it comes to the COVID-19 pandemic about the stance of use of science for the betterment of the safety and health of members of our church. Because how religious and how much service can you do for each other if you're unhealthy, right? You need at least that foundation of basic health. And so, I think it's really striking that, as soon as they became eligible, the prophet and the apostles all got vaccinated. And then they've continued. They've been very consistent in their messaging. And from the perspective of history, they've done it pretty quickly, honestly, although from a perspective of an emergency medicine physician and as a public health person, I would have, I always want to move faster. But I think it's striking that the first presidency has, recently put out, wear face masks, get vaccinated, wear face masks in the temple. How much more instruction, how much more clear do we need? How much, more clear does that brass serpent need to be for us to look up to for saving, in order for us to be saved? And then it's also clear that, they're very consistent in their messaging. Our religion is one that honestly is based on gaining knowledge from primary sources. If our expectation is that we can go to the Lord with a question and expect an answer, when we get that answer, we are expected to act on it. And that translates into science. When science gives us an answer, we're responsible for acting on the answers, for keeping each other safe. And so I think, it's really interesting, whereas 100 years ago, when the technology was not available to stop spread of the 1918 flu, now we have currently a cardiothoracic surgeon who also has a PhD as our prophet, who he understands science, and it's a part and parcel with the way that our religion is lived. So I go back to these questions of what can we learn, in the context of the 1918 flu and what's changed, and the 2019 COVID-19 pandemic, or the 2020 ongoing pandemic. And again, I just raise these questions. What is the role of the church in a public health crisis, and what are the roles and what are the responsibilities of church leadership in a public health crisis? But most importantly, what is my responsibility as a member of the church and as a saint in a public health crisis, and in times like these? What can I do to help take care of the one, lost sheep, so to speak? And so, again, I just sort of want to reiterate the facts, or not the facts, but the ideas that I hope that you take away from this, and particularly in the context of, history and where we are now, and the fact that things aren't over yet. And in the context of Utah having one of the worst mortality rates in the U.S. for the 1918 flu, what is it that we as folks in science and who are involved in gaining and using scientific knowledge and using technology, what is it that we can do to help move Zion forward? How can we take care of each other? How can we serve each other? And I think it's worth asking ourselves, am I, heaven forbid, rejecting a miracle that God has sent in answer to prayers as part of a way to, curb sickness and disease? Am I taking advantage of everything that I can for the betterment of my family and those around me? For those of us who have knowledge and training, are we doing enough to put it into action, particularly in the service of others? So, again, we need science in order to gain knowledge, and science and faith and revelation. So science and faith work together, and when they're used together, they can get us, they can help us accomplish goals and serve each other. And so knowledge by itself is not enough. We really need to use that and apply it to serve our neighbors. I want to leave you with this. I'm sort of joking, but not really. Folks who know me have heard me say that, one of my goals in life is to be a dead-end host. This is a much nicer way of saying it. Hospice ultimus est, be the last host. And I think this is, like a public service announcement from a prior pandemic. The one who stayed away saved all the rest. It's not sexy. It doesn't buy you, a public acclaim, but sometimes the simple things that we do are the most important. And I think right now, in the midst of literally the worst pandemic in 100 years, the message that I want to share with you all today, in terms of, concrete things that we can do to serve others in Zion, are get vaccinated, wear a good mask. We have the technology now, and stay home if you're sick. And maybe we should carry this forward after the pandemic, because 30,000 Americans die every year of influenza, and they didn't have to. I didn't see any influenza last year. I saw no cases of influenza, and usually I see, pretty regularly over the winter. How many deaths can we prevent by just doing our part? And this is part of a plea. I think, maybe you guys have seen this. This is from an Italian physician during the first wave there. Honestly, healthcare workers, we're really kind of traumatized. So I have that message of, like, please get your vaccination, please wear a good mask, please stay home if you're sick, because honestly, we feel like we're drowning. 18 months in, we sort of wonder how much more of this we can take. And on top of the COVID-19 pandemic, people still have heart attacks and strokes, and they get in car wrecks, and they break legs, and they have appendicitis, and they get cancer, and we need to take care of those folks too. Like, those are sort of the other figurative lost sheep that I think is getting lost in all of this pandemic, unfortunately. So now that I'm done with my public health, my public service announcement, I want to leave you with this last sort of reminder, that you're here to gain an education, enter to learn, and go forth to serve. And I think in science, we're particularly well positioned to serve others. We have the skill set and the training to gain knowledge that's of good quality, and we can use it And I think I'm hopeful that, and this is speaking to myself as well, we'll be able to do that more in the future, get involved in our church community and our more global community, establish relationships with people so that, if and when another pandemic occurs, we're not having to build those relationships as we go along, but to really share the knowledge that we have, so that it becomes more commonplace and more generally accepted, for the health and safety of everybody. So I want to thank you all. It's such a pleasure and an honor to talk with you all. And just a couple of fun pictures for the last little bit. This is Dandy. She was our pandemic chicken before we moved to Toronto and had to give up our chickens. This is, in case anybody wants to know, this is what a broody chicken looks like. Feathers are all fluffed up. Chickens are fantastic. And then just a last reminder, just to encourage you all to, remember that as members of the Church of Jesus Christ of Latter-day Saints, the first commandment is to love the Lord, and the second is to love our neighbor. And we are in a unique position to do that in science. And I thank you all. And I say these things in the name of Jesus Christ. Amen. All right.